Dr. Saab, which method do you suggest? I mean, there are two methods of hair transplant. One is FUT and one is FUE. So according to you, which is a better method, easier and painless method, FUT or FUE?
So at my center, I was doing FUT, that is strip surgery, for almost like 4-5 years before I switched completely to FUE in end of 2011, early 2012. This was because of the several benefits of FUE, the benefits that the patients were seeking, and the benefits I became confident in delivering. And slowly and surely, our results improved. FUE has a significantly long learning curve. And that is the reason why many doctors who do FUT are hesitant to make the switch. The time spent in harvesting a strip and the time spent while harvesting in FUE is disproportionate. In FUT, it takes not more than 20 minutes for the doctor to raise the strip and close the incision lines. Whereas in FUE, it can stretch from 1.5 hours to 3 hours. So doctors who do other things like plastic surgery, lasers, fillers, are not the doctors who will switch over to FUE, because FUE takes a lot of their time, a lot of their energy and effort, and it's tiring. It leaves them with very little energy to do other things in their repertoire, other things that they are offering to the patients. So you will never see that an FUT surgeon, a surgeon who propounds FUT, is doing only hair transplant. So in short, an FUT hair transplant surgeon is not a pure hair transplant surgeon. If you keep this at the back of your mind while listening to the rhetoric of the superiority of FUT versus FUE, you will be able to make an informed decision. Well, the chief advantages of FUE over FUT, as I see it, is number one, it avoids a linear scar. If an FUE is done with good patient selection, with due skill, diligence and care, the donor area looks just as it looked before the procedure. And there is very little left to chance. Like in strip cases, patients, even in the best of hands, can land up with the worst of scars. This doesn't happen in FUE because we are not cutting the skin with a blade. There is no linear wound which is closed under tension. Secondly, patients shy away from getting an FUT done today because of the hairstyles that they wear today. Short hair at the back and a long mop on the top is in fashion today. In the best of FUT, done by the best of surgeons, with present day hairstyle, the strip is bound to show. This doesn't happen in an FUE, which is done after good assessment of the donor area. Thirdly, FUT does not allow cherry picking. It does not allow us to pick only the anagen hair. Whatever lies inside the strip, whether it is hair with good growth potential or bad growth potential, is out of the body. Many grafts, up to 20 to 30%, which are in resting phase, will have to be discarded because they cannot be returned back to the body. And as you can see in this video, very lucidly, clearly explains to you the benefits of cherry picking. So, graft wastage is a reality in FUT. In FUE, there is no graft wastage. You have transaction rate, but transected hair grow back. And watch this video as well. So these videos are made to set you thinking so that you do not fall prey to rhetoric of the superiority of FUT over FUE, that you can get more grafts using FUT technique in the combination of FUE than you would in FUE alone. It's not so. It is mere rhetoric by clinics which are not pure hair transplant clinics. Do your research. Research is power.